what's your experience with what I want to call biologics? So by biologics, we're talking about things that are relatively sort of new on the scene, things like stem cell injections, PRP injections, other things, maybe things like hyaluronic acid, which is like a synthetic joint fluid. What's your personal experience? Have you seen many sort of positive outcomes from those? And again, maybe tell us a bit about the evidence base for those modalities as well.
Sure. I mean, so the first thing really to understand, where do we get the use? Why is biologics used? And I think this is all down to what is happening in arthritis, osteoarthritis. People used to actually say this is a disease of the cartilage, but it affects all aspects of the knee joint, from the synovium to the surface cartilage to the actual underlying bone. And one of the aspects is the actual articular cartilage. This is the thing that's obviously wearing away with orthopedics, whether it's age-related or whether it's just general degeneration or whether it's post-traumatic arthritis. And the whole process is in orthopedics is that either you deal with the problem or you deal with the symptoms. And when you're dealing with the problem, you end up having really one option, which is to replace the knee. And we're trying to target those patients where they've got problems with their cartilage. It's certainly not bad enough to, replace. And we want to try and, first of all, control their pain better. And secondly, add some kind of positive kind of homeostasis within the knee. I sort of fall shy of using the term regenerative treatment, and the reason is because the science behind this is still relatively unclear. There is evidence of cartilage regeneration in certain studies and that sort of thing, but really it's not designed to promote regeneration. It's trying to aid the natural homeostasis. In other words, what's happening in arthritis, you get a number of inflammatory mediators, cytokines, what we call bad proteins. And what we're trying to do is replace them, with good proteins, with anti-inflammatory mediators, chemicals, to try and reduce that inflammation, which is predominantly the source of pain. Right. And then try and combine that with all the other aspects of lifestyle medicine, rehabilitation, to really get good healing of their joint.